Good morning to all. Hope all of us are safe in the confines of our homes or offices. I am Marilyn Rama, a medical technologist by profession and currently working at Level 1 Hospital for 31 years. With that length of service in the government, you can guess how old I am. I will be presenting today a study entitled Knowledge, Attitude, and Practice as Determinants of Parasitism among Food Handlers in a Municipality in Quezon Province, the basis for a program. But before I proceed to the introduction of the study, I would like to share some information about the study area. Munisan is a fourth-class coastal municipality with 36 barangays and with a population of 28,241, and that was done in 2018. With regards to water supply, 16 out of 16 barangays have inadequate water supply. Sources of income is 59% farming and 25% fishing. As per record on the Comprehensive Municipal Development and Land Water Use Plan of Unisan, Quezon, 2006 to 2015, problems that pose threat to the local residents' health have been identified, and these include those related to sanitation, brought about by ignorance, carelessness, or inattention by some with regards to the need to continuously maintain a clean environment, and there is also this high cost of providing medical care, partly caused by high cost and insufficient supply of medicine. Deworming in MHO was done regularly during the month of January and July. X-ray was the only examination requested before food handlers are given health certificates. Now for our introduction. As we all know, intestinal parasitic infections are widely distributed globally, and it is also one of the problems in developing, and less developed countries, and it causes serious infections that can lead to death of the host. And most of the time, the disease do not show clinical signs and symptoms to the potential carriers, such as food handlers, making it difficult to control and totally eradicate. The World Health Organization 2019 reported that more than 1.5 billion people, or 24% of the world's population, are infected with soil-transmitted helminthic infections. And these infections are widely distributed in tropical and subtropical areas, with the greatest numbers occurring in sub-Saharan Africa, the Americas, China, and East Asia. Diseases caused by the four main species of STHs are the Necator americanus, Ancylostoma duodenale, Ascaris lumbricoides, and Trichuris trichiura. This is according to Karagianis et al. In 2015. Now, who are the food handlers? A food handler is anyone working in food establishments or a street vendor who handles food, or it may be you, it may be me, or anyone that is likely to be in contact with food and cooking utensils. And these food handlers with parasitic infection are potential sources, or they may become agents for fecal-oral transmission of intestinal parasitic infections to customers. And this IPI causes human morbidity and mortality, posing a large problem, and is linked to poor personal hygiene and sanitation. And according to Saglul et al. In 2011, food handlers that directly deal with production and distribution of foods between societies are one of the most important sources to transmit parasitic infections to human. Furthermore, a study conducted by Tad et al. In 2010 also revealed that most of the foodborne outbreaks worldwide was linked to food handlers. And according to the report, the annual statistical report of Unisan Medical Community Hospital in 2018, this is a government hospital, It shows that that intestinal infectious diseases was the sixth leading cause of outpatient department consultation, fourth leading cause in emergency room consultation, and the second cause of morbidity in hospital discharges. What are the specific objectives of this study? There were 4 research questions that this study seeks to find answers to. What is the prevalence of helminthiasis among the respondents? The level of knowledge, attitude, and practice of the respondents. Relationship between knowledge, attitude, practice, and helminthiasis, and the significant difference between knowledge, attitude, and practice with age, gender, and educational attainment were considered. Now for the methodology, the research design. A cross-sectional study design was utilized in this study. To assess the knowledge, attitude, and practice of the respondents, a questionnaire was utilized. This design is used for population-based surveys and to assess the prevalence of diseases, and it can be conducted relatively faster and are inexpensive and may be conducted either before planning a cohort study or a baseline in a cohort study. And the association between the variables mentioned before are among the outcomes measured using this design. About the population and sampling technique, the study was done among the food handlers and food vendors from December 29 to January 2020. 86 food handlers from the town proper of municipality were randomly selected using convenient sampling. Food handlers who are available and are willing to answer the survey forms were included in the study. The criteria for the selection of participants include working in school canteens, restaurant, meat, fish, vegetable, and food vendor for more than 1 year, ages 15 and above. The researcher uses the subjects that are nearest and available to participate in the research study. The study area is one of the 40 municipalities comprising along with the city of Lucena, the province of Quezon. To collect data, a structured 18-item questionnaire on background information and risk factor assessment was utilized in the study. Drafts of the assessment questionnaire was formulated and submitted to an expert for approval. Specially designed survey questionnaires was then approved and modified after revisions and translated to the Tagalog version so that the respondents would be able to understand and answer the question easily and honestly. The survey questionnaire was divided in 4 categories: socio-demographic profile, knowledge, attitude, and practices on intestinal parasitism, safety food practices, and personal hygiene. The statistical package for social science SPPS version 23 was used for the analysis of data. Difference in means was considered statistically significant at p-value of less than 0.05. The researcher utilized descriptive analysis using mean, standard deviation, and frequency to determine the socio-demographic characteristics and the level of knowledge, attitude, and practices of the respondents regarding the parasitism, hygiene, and safety in food handling. T-test and ANOVA for test of difference, and Spearman for correlation. A thorough health assessment is needed to determine the need to conduct a health intervention program among the food handlers. However, there are some limitations on the assessments done in this study, and these are: the study included a small sample size, and 86 respondents participated. Stool collected, submitted for microscopic examination used in the study may not be the sample coming from the participants themselves, and it did not include the food handlers in the remote areas of the municipality. Also, findings in the study can't be extrapolated to represent the scenario in the municipality, and another one of the limitations is a short period of time allotted for the survey. Now let us go to results and discussion about the socio-demographic data of the respondents. A total of 86 respondents participated in the study. Majority of respondents were female. 63% and 37% were male. They were under 26 to 35 years old. The biggest percentage, 31%, followed by 46 to 55, 27, 36 to 45 years old, 17%, 16 to 25 years old, 18%, and 56 years old and above, 7%. Respondents were categorized according to the nature of their work. There were 33 cooks, 16 kitchen helpers, 20 food servers, and 17 street or meat vendors. Most of the respondents finished secondary level of education, 53%, followed by college level, 28%, elementary level, 14%, and lastly by vocational level, 5%. Regarding the level of knowledge, attitude, and practice, the study revealed that the respondents had an average level of knowledge with a mean score of 0.88, a positive attitude with a mean score of 4.473, and fair practices with a mean score of 3.87 based on the descriptive analysis of data by gathering the mean score of each variable. The study revealed that the respondents had a poor high knowledge regarding the manner of transmission of intestinal parasites, but they are very much aware that washing of hands before handling food reduces transmission of diseases and food contamination. The study also revealed that respondents believe that personal cleanliness, proper handling of food, proper hand washing were very important in food preparation and that it is their responsibility to handle food safely. Among the variables, the belief that the proper technique of washing hands is important in food preparation, and it got the highest mean score of 4.83. The study depicted also that the respondents have a good practice with regards to washing of hands after returning from the washroom, after handling food waste, and making sure that their hands are dry and clean every time they handled food, as shown in their mean score of 4.8, whereas they have a poor practice with regards to wearing any items of jewelry when handling food, and even going to work even if they are sick, and it got the lowest mean of 1.779. The prevalence of parasitism. Among the 86 participants, 32% are infected with intestinal parasites. Ascaris lumbricoides was the most common detected parasite with a prevalence of 12%, followed by hookworm 7%, trichuris 5%, while strongyloides 1%, and Giardia lamblia 1%. The parasites reported in the fecal examination of the respondents can be transferred through oral route and through skin penetration. This may be transferred via the food handlers if they didn't practice proper hand washing, hygiene, and safe food handling. Now we will come to the difference of respondents' educational attainment, age and gender on knowledge, attitude, and practice on intestinal parasitism. Results show that there is no significant difference of respondents' education attainment on KAP, no significant difference of age to attitude and practice, but there is a significant difference between age and knowledge. Age group 16 to 25 have significant lower knowledge compared to age group 26 to 35, age group 36 to 45, and age group 46 to 55. And there is no significant difference of laboratory results in terms of gender and age, but there is significant difference of laboratory results in terms of educational attainment. For the discussion, in the study, analyzing the socio-demographic data of the food vendors, in Africa, most of the food vendors were more than 30 years old and were primary school graduates. In Bangladesh, most of food vendors were males between 19 to 35 years of age. In Nigeria, majority or 98% of the respondents had formal education. And further, respondents with tertiary education have better hygiene habits than those with no formal education. There is a need to better understand communities' knowledge, attitude, and practices of neglected tropical diseases to improve prevention and control efforts. The training of food vendors on food hygiene instead of the level of education had a significant association, p-value of less than 0.05 with crucial food hygiene practices. The global strategy for the control of soil-transmitted helminthiasis is based on regular anthelmintic treatment, health education, sanitation and personal hygiene, and other means of prevention with vaccines and remote censoring. Below, these are the references of the statements I stated. Now, for our conclusion, the prevalence of intestinal parasites among the respondents of this study was at 32%. Moreover, although the food handlers have positive attitude regarding hygiene and sanitation habit, but they only have average knowledge and fair practice. A module entitled Iwas Bulate, a personal hygiene and sanitation program among food handlers in Unisan, Quezon, was developed as a result of this study. For our recommendation, increasing the knowledge and awareness of food handlers about food contamination, motivation of food handlers to promote knowledge and turning it into practice. Training of food handlers on personal hygienic conditions and food safety. Continuous check-up of food handlers should be mandatory. Improve sanitation and personal hygiene to prevent the spread of IPI. Food handlers must undergo parasitological stool examination prior to receiving their health certificates. And then policymakers must be informed of the burden so that appropriate resources must be allocated for food safety and intervention. And then the result of this study must be made available to relevant authorities for them to know the weakness of food service providers in the 3 areas of knowledge, attitudes, and practice, thus aiding to develop special training program for these people with more information and customized to their needs.